Here with a COVID update and other health updates is Merritt Bates-Thomas from the Green River District Health Department. Good morning, Merritt.
Good morning, Angie.
Well, I think we're sort of in this false sense of security. I don't know why that is. The things are getting better. Are they getting better?
Well, we're currently seeing cases trend down in a very positive direction, the direction we'd want them to be going. New cases are down basically locally as well as throughout the state, the nation, and really on an international level.
That is a very good sign. So what are the things you want people to understand about staying vigilant?
Well, the risk is not gone.
Right.
The virus is still circulating, and while we are seeing things trend in a positive direction, we continue to be in an area of high transmission. A couple of our counties have trended down to the orange zone, which means their incidence rate is below that state marker that they look at. But 5 of our 7 counties and much of the state continues in the red area, which is that area of high transmission. So the key thing, if you aren't vaccinated, that's the best tool to reduce your risk to yourself and to those around you, friends, family, coworkers, whoever they may be. And wearing a mask in public really continues to be the most effective way to protect yourself and to protect others and just reduce the spread of COVID-19.
Well, Merritt, are you seeing, more people being vaccinated who have been hesitant, and are you seeing folks step up for the booster?
We're seeing a mix of that, yes. I continue to remain optimistic because we are seeing those numbers inch ever so slowly as more and more people do decide to get vaccinated. And, people continuing to take the good safety measures, wearing masks out in public around those they don't know and in areas that are crowded, especially indoors. So I think if we can all work together on this, we'll continue to get through. The key is that we have to remember while the numbers are positive, the risk isn't gone.
Well, what can help us understand, there are other variants out there besides the Delta variant. Should we be concerned about that, or is that, part of what's going on in our area?
To my knowledge, that's not part of what's going on really in our area. The Delta was highly virulent and very infectious, and that's what led to that great spike that we saw in the ongoing high number of cases and the high transmission. The key thing, there will be variant spinoffs most likely, and the best way to continue to get through this is to consider the vaccination, get vaccinated, wear a mask, use good hand washing techniques, all of those things that we've really learned over the last year and a half plus. And as other variants potentially spin off, what we've learned from Delta can move us forward, addressing whatever we might face with other variants.
Well, and those same practices will be a big asset as flu season has begun.
Right. In terms of reducing any sort of disease transmission, all of the things we've learned can really help us moving forward, not just with flu, but also with colds and other things.
Can folks come by, call you, and get a vaccination there? Or can you advise them on sites for vaccinations?
Right. Vaccines are still widely available throughout the community. Many pharmacies have them. We have them. We have a pretty regular schedule. You can call to schedule your appointment, and we can get you scheduled at the most convenient time for you, for us, working within our schedule of what we have planned for those vaccination clinics.
Thank you for what you do, Merritt. I appreciate you.
Well, thank you, Angie, and take care to everyone out there tuning in today.
Thank you.